Hannah, and this is PBS Reno STEM Works, the show where we explore careers in science, technology, engineering, and math, and what makes them so fun. We take you inside businesses and talk to professionals in the field and explore what they do. Today, we are headed over to visit with our friends at the Reno Orthopedic Center, or the ROC, as they sometimes like to be called, to find out what it is that they do.
PBS Reno STEM Works is brought to you in part by the Desert Research Institute.
Have you or someone you know been playing sports like soccer or hanging out at the park on the playground having fun, when suddenly you fall and hurt your knee or elbow? If so, you might need to go see a specialist like an orthopedic surgeon to get that checked out, so you can get back to running, jumping, sliding, and of course, hanging out with your BFF. So let's head over and visit with some of my friends at ROC and see what they can tell us about what they do. I'll let you in on a little secret. I heard they have robots that do surgery. We'll talk with Sarah DePaoli, the ROC Foundation Director, orthopedic surgeons Dr. Sanjai Shukla and Dr. Justin Walker, and we'll find out about all the exciting jobs available at ROC. I hope you're as excited as I am. Let's go find out what it is that they do here. So tell us, what is your job here at the Reno Orthopedic Center?
I run all of the education labs, all of our research programs, and then all of our outreach.
My job is seeing patients in the clinic who have come in for a variety of injuries.
Fixing broken bones, occasionally repairing tendons and ligaments.
Communicating with the doctors about how to use new technology or new research that comes out.
I cover the emergency room, so as people get hurt during the day, they come in and I assess them and sometimes take them to surgery or determine if they need surgery.
Generally, a patient has worn out their joint either through wear and tear or trauma or a combination of both, and we replace their joints with metal and plastic.
That's great, doctor. So why do you like your job so much?
The most rewarding part of my job is really being able to help somebody who comes in with either an acute or chronic problem that's affecting their everyday life.
I get to meet people at a very low point in their life, people who have a sudden onset of severe pain, they can't walk, they can't use their arm because of an injury, and then I get to restore that function, and I get to see them as they get better and better to the point that they get their function back.
Grandpa can play soccer, pickleball is the new thing, so we get asked 5 times a week whether or not they'll be able to be back on the pickleball court.
Getting to work with my research team and asking these questions that we haven't been answered yet, I think that's the stuff that I love the most.
Could you also explain why your job is so important?
If you look at the population of the country and of the world, we are surviving a lot more injuries than we ever did. So I think orthopedics is important because it restores function to so many people who need that function restored.
What I always tell my patients is our job is to keep active people active.
Hey Sarah, what about you? What does it mean when you research things? And what do you do with all that research?
Some of the research that we do is clinical trials. For example, we have this new technology for a knee replacement, and we want to make sure, so that's been tested, multiple times for many years, looking at how that implant does in patients. And then we just see how they're doing long term. And then once we collect all that data across the entire country, then we send that data to the FDA, and then they can give the public the best answer to, is this implant safe for you?
So, I heard that robots are doing surgeries all on their own here. Is that true?
No, at this point, most people feel more comfortable if there's a surgeon in the room who's controlling everything. Just like with remote driving cars, while they're testing them, we want people behind the wheel to make sure everything is going well.
Okay, thank you, Dr. Walker. I get it now. So how do you use robots?
We have robotic instrumentation and assistive tools for joint replacement. Things like virtual reality or augmented reality.
The robot allows us to see things in 3 dimensions, to plan out a surgery well before we actually get in there. Finding the best way to do something, the most efficient way to do something, the least invasive way to do something. The robot lets us perform that whole surgery ahead of time.
Awesome! What other types of technology do you get to use?
Everything that we touch in healthcare involves some kind of technology, whether it's robotics that we have in the surgery center, or whether it's the techniques that got the surgeons to where they are, that we teach them, all of our students from medical school on up. We use a lot of different kinds of softwares, and so you have to be pretty comfortable with technology. It's super important in research.
To me, joint replacement is the way to further the field of orthopedic surgery and stay on the cutting edge of technology.
This is a career that is continuously expanding and growing as technology and knowledge expands and grows. And that's probably the most exciting thing about this field, is that nothing is going to be the same in 20 years as it is right now.
What are some of the skills you need to do your job?
The skills that you build over any career is going to make you successful kind of in a very broad way, but being flexible and adaptable in the moment, hands down, probably the best thing.
Knowing that not everything goes perfectly, that we have a plan and a strategy on how we're going to do this surgery, that it's something that we may have done hundreds of times.
Everyone has their plan A. You need to be able to have a plan A, B, C, and D, and you need to know when you need to switch between them in order to solve the problem in front of you.
You have to work with a lot of different people and you have to think on your feet, and you just have to be insatiably curious about the answer. And I think that's just really any job.
When you were younger, what did you want to be?
I decided early on that medicine was going to be the field for me. I was always interested in science. We shadow the doctors who are doing this as their everyday life. We try to help out with the patients. We try to learn about their disease processes.
My first love language was research. When I found research, and I was like, oh, something that I understand this. Like, I understand the whole process behind it.
So when I was in high school, I thought I wanted to be an engineer. I was initially looking at nuclear engineering, and I just found out there weren't many jobs in that unless you liked being inside a submarine. And I gravitated toward medicine because it allowed me to problem solve on the fly and to apply the technology that is constantly being developed to solve problems.
What else can I do at the ROC?
If you're interested in, healthcare, but you're not sure if you want to go to med school, there are so many jobs and so many career paths available to you that can still be a part of that passion you have for medicine.
Not everyone has to go to medical school to be involved in the field of robotics or orthopedics. We work on a weekly and monthly basis with engineers who are helping us craft the latest joint implants.
You can be an MRI tech, and you can be a cast tech, and you can be a sterile tech, and you can be a scrub tech, you work in the ORs.
We work with engineers who help design our equipment. For instance, every now and then something's not quite right with the equipment or the instrumentation.
We work with scientists who are demonstrating the latest research, whether it's in animals or whether it's in basic science research.
We work with radiology technicians who take our x-rays, and they help us in surgery. We work with surgical technologists who work with us in the operating room, nurses, anesthesiologists, just a myriad of people who are behind the scenes who really make everything that we do possible.
Oh, wow. It sounds like there's a lot going on. Do you happen to have any advice for us?
Don't let anybody tell you what to do with your life. If you have something that you're passionate about, do the thing that you want to do. You're going to be more successful if you go into an area that you're passionate about. It doesn't matter if it's math or engineering or medicine.
Treat life like a buffet and try to sample as much as you possibly can in an effort to figure out what you really do like and love. And when you figure out what that is, try your hardest to do it.
Important thing to realize is if this is something that interests you, there are so many pathways available to make a career out of something you love.
You have to be really good with people. You got to work really well on your feet. You got to be adaptable in the moment. Like those are basic skills that you can learn in so many jobs, not necessarily just in healthcare. You learn them anywhere.
Wow, that was super exciting. Thank you, Sarah, Dr. Shukla, and Dr. Walker. It was way cool to check out the robots and the other cool tools you use at ROC to help heal people. It was super informative to learn what you do and see how you get people back on their feet and back to being active. More information about the Reno Orthopedic Clinic is available at renoortho.com. For more information on this career and others, visit pbsreno.org/STEMworks. As always, don't forget to get out there and discover what it is that gets you going and on the right path to your STEM future.
PBS Reno STEM Works is brought to you in part by the Desert Research Institute.